Hello, my name is Michael A. Weiss, and I am the founder and executive director of the Crohn's Disease Warrior Patrol. Welcome to the series of video answers sponsored by the Crohn's Disease Warrior Patrol. The issue presented today is Crohn's disease and biologics. And by biologics, I mean biologic drugs. Number one, what are biologics? Biologics are genetically engineered therapies which, unlike other Crohn's disease treatments which try to suppress the entire immune system, biologics target a specific trigger which is involved with the body's inflammatory response. Number two, what is the science behind biologics? People with an autoimmune illness like Crohn's disease have overactive immune systems, whereby when there is a medical threat to the body, the immune systems overreact and start to actually attack themselves. With this in mind, scientists and researchers trying to find a cure or a effective treatment for Crohn's disease have identified a protein in the body which is primarily responsible for the body's inflammatory response. This protein is called tumor necrosis factor alpha, or TNF for short. By putting together these two theories, scientists have devised these biologic drugs which work by inhibiting or slowing the inflammatory response by targeting this TNF protein. That's why they're called anti-TNF drugs or anti-TNF agents. These biologic drugs or anti-TNF agents bind to this TNF protein, thereby preventing it from activating the body's TNF receptors, which scientists have identified as being primarily responsible for the inflammatory response by the body's immune system. Doctors don't seem to completely understand how these biologics or anti-TNF agents work, but many studies have been done and they know that they do work. As a result, biologics or anti-TNF agents have become quite popular now in treating moderate to severe active Crohn's disease patients. Number three, what are the specific biologic drugs, or agents as they're sometimes called? For the purposes of this video, I'm only going to talk about three such anti-TNF agent drugs. There is a fourth drug, but it is not yet as popular, and it involves a lot more of a scientific explanation, and let's hold off on that for another time. The three most popular biologic drugs are Remicade, Humira, and Cimzia. Number four, when are biologic drugs used to treat Crohn's disease? There's essentially two opposing theories on when a patient should be treated with biologic drugs. The first, and probably the more prevalent one right now, is what's called the step-up theory. The step-up theory advocates that biologic drugs are appropriate for a patient with moderate to severe active Crohn's disease when they've exhausted all conventional therapies and nothing's helped and they need something to help them to stave off surgery or just, perpetual intolerable pain and suffering. Therefore, the step-up theory pretty much states that biologic drugs are the last line of defense for someone who has moderate to severe active Crohn's disease. By exhausting all the conventional treatments and medications, this means that the particular Crohn's patient has tried various drugs and either has had success, but that success has stopped, or they never had success with the drugs. Typically, these drugs include four different classes of medications. The first one is basically a sulfa drug, and the example I give is azolfidine. The next one is antibiotics, such as Cipro or Flagyl. The third one is steroids, like prednisone or Entocort. Entocort is sort of like a newer type of steroid which has less side effects than prednisone, which, as we all know, has some very dangerous short-term and long-term side effects. And fourth are the immunosuppressive drugs, which typically are Imuran, 6-MP, methotrexate, or cyclosporin. Contrary to the step-up theory, some physicians, and this is a position which is really beginning to take shape around the country, they believe that starting with biologics for the patient who has moderate to severe active Crohn's disease is really the best course of action because it avoids the complications that these other drugs may cause, these drugs which I listed in the 4 classifications. And also, they believe that by starting with biologics, the physician is basically altering the history of the disease, or at least potentially altering the history of the disease. It's important to note that when a physician uses biologics with that patient who has moderate to severe active Crohn's disease, they often pair it up with some of these immunosuppressive drugs because various studies have shown that the combination of these drugs works well in tandem, both to attack the actual flare-up of Crohn's disease and to maintain it, basically to put it in remission. So the goal of turning to biologics is to actually, treat Crohn's disease when nothing else will help. This is under the step-up theory. And also to hopefully put the disease in remission so it doesn't bother the patient for several months or several years if they're lucky. Number 5, how biologics are administered. The drug Remicade is an infusion. Typically, the patient would go to the doctor's office or to some type of infusion center or even a hospital. And a lot of this could also be mandated by the patient's insurance company, whether they cover it at the doctor's office or if they cover it at an infusion center. And that may also have to do with different drugs too. They may cover Humira but not Remicade, depending upon the case. So the patient really has to understand their insurance policy and maybe ask a lot of questions before they commit to a particular therapy. But Remicade actually starts off with 8-week intervals. So the patient would get an infusion every 8 weeks. Now, I have been through each of these medications, and my experience with Remicade, which I know a lot of other patients have emailed me and shared their experiences with me, which is very similar, was that I started it at 8 weeks. It worked very, very well, but then soon I needed it quicker. So then it was every 6 weeks. And then a couple of months later, it was every 4 weeks. And then I needed more of the drug, so they started giving me twice as much. And then after a while, I sort of outgrew the drug. Now, that doesn't happen to everybody, because I know people who have been on Remicade since 1998. It's now 2013. They don't have any side effects. They're doing extremely well. So Remicade does have a really good record amongst many people who've suffered tremendously from Crohn's disease. Humira is an injection that the patient gives him or herself every 2 weeks. Now that dosage can be varied depending upon the patient and the physician, but typically it's every 2 weeks. And obviously what I said for Remicade goes with the Humira. There are insurance company issues that the patient has to sort of deal with. And actually, you may have to work in tandem with your physician to write various letters to get it pre-certified. I mean, don't just say yes, start the process, and then try to get reimbursement from your insurance company, because biologic drugs are extremely expensive. So you need to get all this information locked down before you begin one of these treatments. Cimzia is also an injection, but typically it's every 4 weeks or once a month. And again, there's a lifestyle component to this where you just got to give yourself a shot once a month. I mean, a lot of patients are averse to giving themselves injections. After a while, with a chronic disease, you learn to sort of live with it. And I always liked Humira and Cimzia over Remicade just from a lifestyle perspective, because I didn't have to deal with the whole insurance submission and make sure I got it at the doctor's office or at the surgery center or at the infusion center. And also, I had to stop my life and go somewhere to get medication, as opposed to giving myself an injection and being independent. And I know a lot of Crohn's disease patients, when they get this sick where they need biologics, independence is a very cherished commodity. A lot of patients and their parents who are contemplating starting biologics also ask me, how soon does it work? You know, do you get the drug and is it like a painkiller where it gets infused into your blood and then all of a sudden you start feeling better? It's not like that. It varies from patient to patient, but the best way I can put it is that you don't get better in days of the infusion. It's more like weeks. It's not months. And it's typically not days, although I have had great response in maybe 5 days. That happened maybe 3 or 4 times, and I was on it for many, many years. But typically it's a week or 2 or 3. And obviously there is also like a cumulative effect that, you know, once you start taking the biologic for 2, 3, 4 months, it starts building up in your body, and then it starts to work on you. Like I said, doctors don't really understand or completely understand how these drugs become anti-TNF agents. So therefore, from a genetic perspective, each patient is different, and therefore the response each patient is going to see, whether it's a positive response or it's a negative side effect, and when that happens is going to vary from patient to patient. 6. The side effects of biologics. Biologic drugs were first used to treat moderate to severe active Crohn's disease in and around 1998 when Remicade was first used. After a while, the FDA started to build up obviously a bunch of patient histories, whether they were praises or complaints, and then other biologics like Humira and Cimzia entered the marketplace with FDA approval for specific use for the treatment of moderate to severe active Crohn's disease. The initial worry about side effects was tuberculosis, and also associated respiratory effects. So the box of the particular drug, whether it was Remicade, Humira, or Cimzia, it would have a warning that, if the patient takes this drug, there's a possibility they could get tuberculosis or some other respiratory side effect. But that soon changed in the early 2000s when Humira had been out for a while and Cimzia was coming out. And the FDA had a database of a lot of patients who had been on biologic drugs for the treatment of Crohn's disease. The problem was that the FDA was seeing that some patients, and again, this is some, I don't know statistically if that's significant or not. I know that they've been severe and they've been fairly frequent, but there are some, if not many patients, who came down with very severe side effects. These side effects include, but are not limited to, rare cancer of white blood cells, potential fatal pulmonary fungal infections such as histoplasmosis, lymphoma, other cancers, severe and possibly fatal respiratory tract infections, liver failure, lupus, severe joint pain, etc. But there were also people experiencing tremendous benefits from taking the biologics. So basically it became sort of a, weigh the risks versus the return. And to do that, what the FDA did is they issued what in their world is the strictest warning. It's called a black letter warning. It's a black letter warning on the box of the drug. It would include all of these side effects which I mentioned, and it basically instructs the patient and the physician that by administering this drug, there is a possibility that you can get any one of these side effects and you may die from them. Number 7, biologics side effects versus biologics efficacy. What do you do when you have severe Crohn's disease, you've exhausted all conventional therapies, treatments, and drugs, and now your doctor is recommending that you start to take biologics? You start doing research and you see all these side effects and you get scared. You start hearing about people whose lives have been ruined by this drug. On the other hand, you hear about people who've had wonderful experiences with this drug. Who's right? Who's wrong? How do you know? Is it genetics? Is it just luck of the draw? Well, what I tell patients and parents who come to me with that sort of problem, I tell them that at this point in time, for now, do whatever you have to do to survive. And right now, if you're at that point, it's taking the biologics. But do so with a positive frame of mind that right now someone somewhere is either inventing a new drug or refining biologics so that they're not going to have as lethal or as many side effects. When you take all things into consideration, I tell these patients that it's best to embrace whatever treatment is in front of you, particularly if it's the only treatment that's in front of you. And if it's biologic drugs, then embrace them and just pray for the best moving forward. And it wouldn't hurt to be a little bit lucky.